so on and so forth. I will say that every day I am going to find a new indication of in neurointervention lab, and sometimes in neurointervention lab you are assisting bleedings of other specialty as well, like for angiofibromas of ENT, you are embolizing that tumor. Sometimes the bronchial artery vessel bleed, you are helping in glue embolization of those vessels which are being bleeding acutely. So it's sometimes in emergency it's life saving as well, but it throws many challenges to anesthetist as well in terms of remote location. I will say the location of DSA lab is far from the OT, sometimes on the same floor, sometimes on a different floor. You are lucky if it's on the same floor. There is restricted area of work, restricted and I will say a dark area of work, and freezing temperatures. So patient and the anesthetist as well are hypothermic at the end of the procedures. So there are many challenges which we are going to discuss in the coming slides. So coming to the goals in intervention neuroradiology lab. So apart from the usual goal of maintaining the CPP, the most important goal in DSA lab is treatment of complications. Now, treatment of complications, I mean, is that the complications, it's actually been procedure specific, but largely you can divide complications among two things: the hemorrhagic complications and the thromboembolic complications. And early interventions in those complications is the key to the final outcome of the patients. Apart from that, management of anticoagulation, that is heparin, intra-arterial antiplatelets, which we usually give, radiation protection. So these are the things which you are subsequently going to discuss in the slides. So that's what I have enumerated. You can actually divide the complications into three parts: the CNS part, the hemorrhagic thromboembolic, the non-CNS part, that is contrast induced, puncture related like groin hematoma, retroperitoneal hemorrhage, anesthesia. So remote location we have discussed, anticoagulation related, so bleeds and all those things, or a thromboembolic complication again, and to reverse heparin and all those things comes under complications related to anticoagulation. So first I will come to the radiation protection, because your safety is paramount. So you and your staff or your technician safety. So if I will say, what are the sources of radiation? What are the sources of radiation in a DSA lab? So it's a direct radiation from the X-ray tube, leakage through the collimate